Hello.
Hello, welcome to another Friday Night Feels. I'm so excited because I have two amazing friends and colleagues joining us tonight. But before we rock and roll, a friend of mine had asked me a little bit about what Friday Night Feels was about and how it came into creation. So I thought we'd start tonight with just a little of the background of, so I'm Patrick Monette, for those of you who've never joined us before. I'm a licensed mental health counselor in the Plattsburgh area, Plattsburgh, New York. And when everything happened with COVID and we did the quarantine and everything, I think we all just kind of lost our orientation a bit. At least I know I did. So after I found a little bit of new normalcy in the new world, I decided to create this bi-weekly Friday Night Feels show for myself, but also for the community, to pull in different resources, different people, and just to kind of connect, talk about real life stuff regarding wellness, recovery, and mental health issues, and also be able to pull in other people that I know and talk about their experiences. Wellness, recovery, mental health issues. Hold on 1 second. I'm having feedback. Oye, ¿puedes apagar la radio? It's speaker in the living. No, búscalo. Sorry about that, just some technological issues. You know me in technology, it's smooth as like rough paper. So tonight, I would like to welcome two new guests to Friday Night Feels, Amy Larman and Paula Lavocat, and I would like them to introduce themselves a little bit and kind of share who they are. Amy, why don't you start?
Okay, before I start, I think you have to set it on gallery view so they can see all of us.
What? There we go.
Yeah, it's on speaker view.
Oh, I didn't know. I blame the dog. Is that better?
Yes,
Okay.
There you go.
Thanks.
So yeah, I'm Amy Larman. I'm a licensed clinical social worker in Plattsburgh, New York, and I currently work for North Country Behavioral Medicine, which is also in Plattsburgh, New York. So I'm happy to be here and looking forward to tonight's show.
Yay! And Paula,
And me.
dum-dum-dum.
Yes, he's so excited for me to be here tonight. I don't know why. We'll see what happens. We've got 60 minutes to mess some stuff up. Anyway, so I'm Paula Lavocat. I'm originally from Buffalo, New York, the other side of the state from you guys. And I now live in the Raleigh-Durham area. I am the clinical director of a large private practice in the Raleigh area. And I'm also a team member with the Institute for Creative Mindfulness as a training facilitator and consultant.
And you are a delightful flower of joy in my life.
Oh, bless you.
As she put, I think if you notice her background, it's the Muppets. And I think we would be the two old men that would make fun of.
Yes.
But therapeutically and trauma-informed always. We wouldn't ever do anything with any malicious intent.
Absolutely not. Never.
So one of the topics that I wanted to focus on tonight is actually trauma-informed. And we do have some shout-outs tonight. Dr. Jamie Marich is saying hello to us. Hello.
Oh.
Hi, Jamie.
Elizabeth Burnett is saying hi to Amy specifically. I guess the rest of us don't matter. And Blaze is saying, hey, there you are. How are you all doing tonight? So we're so glad
What's up, Blaze?
Yeah.
Hi, Blaze. I don't know you, but hello.
Oh, he's a gem. He's wonderful.
And, one of the things that we talk about often is, we throw around, or a lot of times that word trauma is thrown around. And I thought maybe it would be helpful to kind of spend the evening just talking a little bit about what it means to be trauma-informed therapists or trauma-informed counselors, however you kind of identify yourself. And it was interesting because as I was thinking about preparing for tonight, I don't know if I ever shared with the both of you kind of like my background with trauma, like professionally. It was really interesting because when I entered the field, I can honestly say I was not a trauma-informed therapist at all. When I was in school, we didn't really focus on it. I don't know. It was a very broad approach to like the general studies of mental health. And then when I began working, I was focusing on substance abuse, which, as we know, is ridden with trauma. And it was interesting because back then, even in the field, like other professionals weren't trauma informed. I remember being in team meetings where there would be debates and arguments about why someone kept relapsing or wasn't compliant in treatment. And people would think, it was almost like two sides where they're being selfish and lazy, or it's trauma. So the trauma was the reason that they couldn't comply. And I think we were all sort of at a deficit of really understanding the role of trauma. And it took me a long time to really understand that and integrate it into my own life as a person, and to understand my trauma and experiences in life, and how to truly be a trauma-informed therapist. And I look forward to kind of hearing your experiences and of what that means to you. And for people who are tuning in, when someone says, what is a trauma-informed therapist? There's really a lot of different definitions, but when I looked it up and when I'm studying it, it's really about understanding, and this is just my very brief definition. It's really understanding the impact that trauma has had on people's life. And when I'm in a therapeutic situation of really doing the best I can to create a safe, calm, compassionate environment to help model a therapeutic journey for my clients. And I think it's one of those things, and with everything going on in the world, I think being a trauma-informed therapist is imperative in our worlds. And I think we're constantly learning different nuances and different ways that trauma can affect people's lives, and then how that's going to be presenting in the therapeutic world. So I'm just kind of wondering, like, what your experiences are, how you came to, because I consider you both trauma-informed therapists. I don't know if you both do. Oh, well, I put you on the panel, so I guess it's happening. Welcome. What are your experiences with that?
So I was actually lucky enough that in my graduate program, my internship was at a VA hospital down in Albany. So my first real experience with providing clinical services was with veterans. So I was kind of thrown into a world of learning about PTSD from a combat veteran standpoint, and working with those folks initially. So I had kind of a really intensive education on trauma and PTSD at the graduate level, and I also took an awesome traumatology course in grad school that just really kind of lit the fire of my interest in it. And then in my first job out of grad school, I was lucky enough to have a supervisor that was really well versed, kind of ahead of her time in trauma treatment. And I also had a mentor who was an art therapist who was just absolutely brilliant. And I learned so much from her, and she was, again, way ahead of her time in terms of trauma-informed care, trauma-focused care, and the way she provided treatment, and also through, an expressive arts medium. So it was really cool to learn a lot from her.
Wow. That must have been so amazing, like different approaches.
Yeah, absolutely amazing. And then I ended up, almost early on in my career, working with some individuals with dissociative disorders, specifically dissociative identity disorder, and just, threw myself into learning as much as I could, researching as much, leaning on those two kind of mentors. And it's just always been something I've absolutely loved. I love treating, love working with individuals with dissociative disorders. And now that I'm EMDR trained, I'm loving using that as a tool to treat dissociative disorders and trauma as well. So it's always from the very start of my graduate program, trauma treatment has been kind of an integral part of who I am as a clinician.
Oh, that's so amazing. And I'm just going to clarify for some people too who ask sometimes, because I think when we get in counseling mode and we talk amongst ourselves, we sometimes forget that people may not know what certain things are. So we're all trained in a specific therapy called EMDR, which is eye movement desensitization and reprocessing therapy. And we'll definitely get more into that tonight. Paula, what's up?
Oh, me?
Happy Friday.
Yes, darling. Happy Friday. Let's see. So, backstory for me. I went to a private graduate school. I won't throw shade on it. It's not the one on my shirt. because this is the only one that I'll recognize still, NC State, red and white for life. Anyway, so the portion of trauma that I learned about was basically nothing. It was part of a CBT class. They had us buy a book. We never used the book. And the book is across the hallway in a big laundry basket that I'm planning on maybe moving this weekend to my new house. However, one of my dogs chewed the corner of it off. So you can tell that it's really been used. Anyway.
Quality.
Yeah. Jamie's saying throw shade. So it was Campbell University in Bowie's Creek, North Carolina.
Hey, don't get my show in trouble, Jamie. Hey. No, just kidding. I'm going to get hate mail now.
And Blaze Harris says go Pack because he's also a proud NC State graduate. So anyway, so the book, the dog chewed it. It's been laying there. I've had it for probably 10 years. And so I was running a SAOP program, which stands for Substance Abuse Intensive Outpatient Program for those who aren't familiar. And with my no trauma education, I suddenly started detecting a pattern because you learn that critical thinking crap in grad school and you start seeing things and you're like, whoa, hold on a second. Every last person that I've assessed and put into this program who's in my groups has some sort of major trauma. Made sense. So I asked my supervisor, who I definitely won't throw shade on. He does not even on Facebook. But anyway, I said, what do you do when there's somebody with a lot of trauma? He said, oh, we'll address that later.
Oh.
Let him get some clean time. We'll address it later.
I've heard that so often. It's heartbreaking.
Yeah. Makes me want to vom now, really.
Right.
Yeah. And I treat active addiction with EMDR therapy. So, and who could say that they're not in some sort of active addiction? Everybody says they have a vice. So I might be clean from drugs and alcohol, but food is still my thing.
Right.
But anyway, so I fell into Jamie by doing some research on EMDR therapy training programs, and I wanted something with an addiction-ish focus. And so based on her background and reading some of her writings and things like that, I didn't stalk her like a lot of other people have. It was just a mild stalk. I wound up going and taking
Just go with that. Yeah.
Okay, I'm a stalker.
I have found that to be true. She knew things about me I didn't know.
Oh, is she a stalker too?
No, you. It was like going to a psychic. Our first conversation, it was like that awkward first date. And you're like, oh yeah, blah, blah, blah. I completely forgot it was on my Facebook.
My son just commented on the here. He said, whoa, oh my God. So anyway.
Your mom loves you.
Love you, Richard. My A1 from day one. Anyway, I wouldn't be where I am today if it wasn't for inspiration from him. So don't burn my house down. Anyway, so it's our house anyway. So Jamie, I fell into her arms and it was lovely and magical. And she embraced me and welcomed me. And since joining the ICM family, I feel like I'm at home, which you know that we're a very diverse group.
Yes.
With lots of diverse things that we do. And
it's kind of like the Island of Misfit Toys, but so much cooler.
Okay, dude, I said that years ago. Did you steal that from me?
No, we're connected. We're connected. Well, it was funny. I think before Amy popped in, I was sharing with Paula that, that you were trained at the training that I was shadowing at Adams. And the funny thing is so that's about 2.5 hours south of here. And I didn't know Amy was doing the training. So she walked in, I go, oh my God. And I just hugged her. And she's like, oh, hi. I'm like, sorry, I'm a hugger.
Wait, so y'all already knew each other?
Well, I
The whole
think
reason I was there was because of you, Patrick.
I
Because
didn't know, because
we had tried to
do the EMDR training in Plattsburgh, but it just wasn't in the stars. So, and I felt bad because, you know, it was with ICM and working with Jamie. I really, because my background a little bit is I got trained in EMDR in another institute, which was very different. And it gave me the basics, but then I started working with Jamie. And what I love about
saw the light.
Well, I love the Institute because it really was trauma informed. And every time I'm doing consultation or I'm part of a training, it reinforces and helps me develop my skills and understand the absolute importance of being trauma informed. Because just like you were saying, Paula and Amy, I usually don't use the word envious, but I'm envious of your experiences because those just sound amazing. Because mine was very similar to Paula's, where I'm in the field and I'm seeing these people who are coming in and they don't want to be in this pain. And I wouldn't get, when I went to supervision at that time, I wouldn't get CBT. I would say, well, why don't you try DBT? BT. And it's like, I'm not trained in DBT. And even though there are amazing components of DBT, and I know it changes people's life, once I found EMDR for me, personally, it changed my life, but also professionally, it was this amazing explosion of understanding. And I think we've all kind of talked about this when the EMDR and folks get together, it's almost that same phrase of, what was I doing before?
Exactly. So I would like to have all my clients from that SAYOP program, so basically from 2010 to 2017, come on back. We're going to fix it for real now.
Yes, yes. And I've had some people who, you know, now I'm in private practice, I've had some people that I've worked with find me again, and then I almost feel like it's destiny saying, here you go. Here you go.
Yep. 100%.
And I think Amy and I have talked about this. One of the things that surprises me is the resistance to some people wanting to even learn EMDR to offer it. And Jamie and I have had this conversation numerous times of, if you're not working on trauma or you're not comfortable working with trauma, what are you actually working on?
What are you treating?
What are you treating?
Mm-hmm.
Because and with EMDR, I think one of the myths is that it's just for PTSD or just for significant complex trauma, but it's so applicable in so many different lives, in so many different aspects of a person's life.
Yes.
Absolutely.
And I've treated some weird stuff with EMDR.
Oh. Well, we're going to have to do like Friday Night Feels After Dark when we can go a little bit deeper into that.
Sure.
And you know, being able to see like what experiences have you seen with other professionals who aren't trauma informed? No.
I shall reflect on a passionate meeting that we had the other day with my private practice, where one of our family therapists was telling one of my supervisees to, you know, why are you wasting my time if you're not ready to do this work, whatever. And I said, that's you taking two broken people and bringing them together and trying to make something right. You can't, two wrongs don't make a right. So you've got to, and pushing them away, I said, that's an attachment rupture. You can't, you know, my wife is leaving me, my husband's leaving me, and now my therapist is leaving me. And honoring the fact that maybe the person's not ready yet. Maybe they need some motivational interviewing, something like that. And so I gave a very passionate soliloquy on that for about 3 or 4 minutes, and then I shut my mouth. But
really? I have a hard time believing it.
Okay, whatever. Anyway,
filter free Fridays.
Yeah,
it's a rule.
Okay, my child's watching.
I'm sure he'd be shocked.
He's heard all the curse words in English and Spanish.
Vámonos, vamos a hacerlo en español, me encanta.
Anyway, so the whitest white man speaks fluent Spanish. I love it. Hey, when in Rome.
Bring it. Don't put me in a box.
Nobody puts baby in a corner.
So I have a kind of very current response to your question, Patrick. So just today, I had a physician's assistant who I work with refer someone to me, and she was sharing that the individual that she wants me to work with has seen a number of therapists in the past, and that each one never did anything about essentially what we call resourcing in the EMDR world, but coping skills, grounding skills. She was never taught any of those, and then she was asked to just verbally recount her trauma, and that was essentially the extent of her trauma therapy in the past. So the PA, the physician's assistant, is asking me to see her and use EMDR as an approach with her, which sounds like it's very much needed, and that she absolutely needs those coping skills and those grounding skills. And that's harmful, trying to have someone talk about their experiences and not giving them any coping skills.
Yes.
Anything to help them manage the pain and the emotions and everything else that's going to come up. And so that's not the first time I've heard that. So that's often been my experience, is just, throw them in, rip the wounds open, and leave them hanging.
And
I tell people it's like putting a Band-Aid over a laceration that's bleeding out. That's an analogy that I use.
And it's so hard, when people come in and they're telling you their experiences with trauma or their experiences with other therapy. And I'll say, usually I'll ask, what's worked, what hasn't worked. And I can't tell you how many times people can't tell me what's worked. Like, it's been nice having someone to talk to. And then usually by the end of the first session, I've given them at least one resourcing coping skill. Because even if they never come back, I want them to understand a little bit that and that's what I love about EMDR, is these techniques, when we're talking about resourcing or coping skills, are so efficient and amazing that you can use them anywhere at any time. And what I see time and time again, and it's one of the things when you're doing a training in EMDR, you're working with a new consultee, is it going to work? And then all of a sudden you see that it works. And it's like the person, their spirit can just breathe a little bit easier. So I just want to share a couple messages. So Sarah saying totally dancing around trauma prior to EMDR, saying that it's very valuable to us. Jamie's saying Paula fell into her. It sounds a little dirty. I said Friday night feels after dark. We'll be there. Blaze is confirming you are a stalker. And
Blaze is a stalker anyway. So
Elizabeth is asking, and this is a good question, we're going to get to it, is if we could flesh out what trauma is. And I think,
what is trauma? Geez, would you like the EMDR manual version, the Dr. Jamie Merritt EMDR manual version?
Oh, well, see, I don't have that type of memory. I embody it, of where I say trauma can happen to any of us, and it's a wound. It's an injury.
Yes. Any unhealed wound.
And yes. And I give different examples where I'll break it down of saying, a lot of times when we hear trauma, we correlate it to PTSD. We correlate it or relate it to, there's only certain populations that can have trauma. Vets, people in 9/11, survivors of sexual assault. But trauma can be in any shape, size for anyone. And then usually what I do is I go into the adaptive informational processing model, which is other part of EMDR, but I try to bring in some of the information when I'm talking about trauma, of saying how it affects us emotionally, physically, and mentally, and what it does to our brain, without getting too technical. and saying, you know, how trauma can affect our brain processing, how it can affect our ability to kind of relive those memories. And a lot of times when we're talking about PTSD, flashbacks, where people feel that they're reliving those memories. So I kind of try to do this overall view so that when people know when I'm talking about trauma, it's much more obtainable and understandable.
Mm-hmm.
How would you both define trauma, or how do you define it with your clients?
Well, I think one thing that I like to point out to folks, because like you're saying, there's often this, you know, preconceived notion that trauma means this big, significant, one-time event, or, you know, something that a combat veteran has experienced, that type of thing. But I also like to talk to people about, you know, we all have these negative cognitions, these negative thoughts, these negative beliefs within ourselves. There we have messages that we say to ourselves daily, where we beat ourselves up often. And those messages didn't come from nowhere.
Right.
Those negative beliefs about ourselves originated somewhere in our personal timeline. And whatever happened to create that negative message that we're beating ourselves up with was not a pleasant experience. So no, was it a major automobile accident? Was it a plane crash? Was it combat? No, but something happened somewhere in our history that now causes us to say, I'm not good enough, or I'm a failure, I'm
Unworthy
alone,
of love.
I'm unloved, I'm not lovable, whatever those messages, whatever those thoughts might be, they started somewhere. Something in our timeline created that, and that is a trauma.
Mm-hmm.
Yeah. So, I have a spiel I give. I won't do the whole thing here, but I explain to people Criterion A PTSD events, the big ones like Amy just mentioned. And then I'll break it into, even though in the newest Shapiro text that came out a couple of years ago, she no longer uses, you know, large T, small t trauma. However, I've gotten well, I was never in the military.
Mm-hmm.
I don't have trauma. How can I have trauma? So I will give the Criterion A PTSD stuff, examples of what that can be. But then I go into, you know, the adverse life experiences or the small t traumas of being not life-threatening, but ego bruising and exceeding your ability to cope. Mm. And I have a pretty lengthy list of examples that I give. I'm in the middle of a trauma right now. I'm moving. That's trauma. Mm-hmm. It's definitely exceeding my ability to cope. Purchasing a home, just did that.
Yeah.
That's definitely exceeding my ability to cope. Jamie's yoga nidra knocked me out. I used it 2 nights in a row and I woke up like 3 hours later and she's talking to me about my chakras in my ear. I'm going, oh, holy shit. Let me take these earbuds out because she's still talking to me. I thought I was going to play the one track and then go off, and no, it was the whole album. So I don't know what implicit messages, I don't know what type of implicit messages she put in me, but
just go with that, honey. You've had a rough day. Just go with that.
Lord have mercy.
And by the way, I have to share with you, I'm just going to interrupt because I think this is important, is a Richard Ford is saying, hi, Mom, I love you.
Yes, I saw that.
So maybe that will help your coping skill during this stressful time.
That's my baby.
Well, I also
want to everything and then some.
And even though we're taught, you know, some people might say, you know, the other thing too, kind of what we're saying is there's this implicit judgment in my trauma is worse than yours, or yours isn't as good as mine. Like, for example, Paula, for you sharing that you just bought a house and you're moving, it is traumatic, and it's also happening during a pandemic. So it's not like people can just come over and help. And I'm sure, like, I think, Amy, you and I have talked about that too. It's like the overall everyday life stresses can have that traumatic experience now because so much of our normal life has been changed.
Oh, absolutely.
Yeah. It's called chronic daily hassles. I had a professor say that once and I totally stole it. Chronic daily hassles.
It's going to be on a t-shirt.
Like when I was getting Richard Ford out of bed for school in the morning when he was younger, that was a chronic daily hassle.
I'm sure he loves you so much right now. I can feel the
he totally does
chit-chat when you get off of this. Ray is checking in with us and saying, yeah, I've had a lot of that where you want to know what happened, but don't do too much to help with coping with it. I think that's a really powerful statement. I'm glad you said that, because going back to kind of what Elizabeth was asking about trauma is so many times when that traumatic or disturbing event has happened, we don't want to talk about it. We were embarrassed, that shame, that fear, the anger, so we're just going to bury that. But then what happens when you bury poison? It's going to bleed into everything that you do. And so that's where, when I'm working with someone who's struggling with that, they'll come in and they're not saying, all right, I have trauma. They're saying, I have explosive anger, or I can't get out of bed because of my depression, or my anxiety is so awful, I can't do anything. But then little by little, as you pull the layers apart, in that safe, gentle, trauma-informed approach, you're going to hopefully work with that client to uncover some of these traumas. And then using appropriate trauma-informed care, help them get some resolution.
Yep. They're going to figure out it's their mama's fault. Or dad's.
Right.
Yeah.
And
I sometimes call this blame the parents therapy. I really do.
Really?
Yeah, legit.
Oh, how's that working for you?
It's working great, because usually it does go back to either a parent or a caregiver.
Well, you know, what's interesting is, as you both know, is that I love working with couples, and there's so much there too, but as you were talking about when there's an attachment injury, but so many times couples will come in and part of the intake work is, do either of you have any trauma? And they may not have any previous trauma, but if there's been a breach of trust or a betrayal or a loss, that trauma has just been born.
Mm-hmm.
And it will change the way you see the world, the way you see yourself, and the way you handle stress or your inability to handle stress. And
then you have a client say to you, gee, I thought I had a really good childhood until I met you.
I've heard that too. I've heard that too.
Yeah. And I'm like, well, your dad's an alcoholic.
Well, I've also heard that too, and I've also been told you're not very nice, but you're good at what you do. I'm like, I'll take it as a win.
So I'll be the unfiltered one. I usually know a target's going really good, and I've done some really good interweaves, and we're almost there when somebody says, fuck you, Paula.
Yeah.
They get mad at me because I do an interweave, and they connect the two ends together, and boom, and they're like, fuck you, Paula. Mm-hmm. Because they're like, I do some Socratic interweaving and bring it together for them, and then they go with that.
Well, you know what's interesting is when I've had, and Amy, I'm sure you can relate to that too, when you have a client tell you to F off and you have that good therapeutic relationship, I kind of congratulate them, because I said, better out than in. Like, I want you to be able to feel safe that you can get angry at me, because then we can work on that. And then your relationships with other people are going to be so much better. That's just my theory.
My mom always used to say better out than in too, but it didn't have anything to do with therapy.
There's interpretations of everything. So Amy, what were you going to say about your experiences being told to F off?
Piggybacking on that more often than not, the anger has to come out at some point in the work, and there's anger underneath so much of it. But yeah, it often comes out at us, but that's often part of the process. And
one of the things, I just had this discussion recently when we're talking about trauma, is when for my practice, when we're talking about trauma-informed care, I want to create foster that safety, but I also want to be real and genuine and be that reflection on clients of, yes, you do have trauma, but you're also choosing maybe a maladaptive coping skill. Like punching someone in the face because you have trauma is still problematic. So let's work on that. Like it's kind of like addressing, two situations at once and saying, why don't we just pull this apart and then work on the trauma so you're not catching a felony. But I don't know, that's just... Which again goes back to the importance of teaching coping skills, grounding skills, emotion management skills, whatever you want to call them. Yeah. Those need to be taught. So we don't get punched in the face in the process. I mean, yeah, like I can it's like dancing, like.
That's dancing mindfulness.
Listen, oh, well, we got a request after. We have to close with big box, little box, because it's part of tradition. So don't worry, we will get there. I think we added a new one when Blaze was on last time. I think it was, I did the mask one, but we'll get there. Don't worry, there's plenty of time. One of the other questions that I have that I wanted to throw out to you both, when we're talking about trauma-informed care, and Elizabeth, I hope that gave you a good explanation, or anyone else, so just send a message and if you want more clarification. Because I think all three of us could probably talk for a year on trauma. One of the things that I experience is, and I'm not judging, I'm just putting it out there as a conversation piece, is other people in the field or in human services who are so afraid of addressing trauma. Kind of like, Paula, what you were saying is we'll address it later. With the background of addiction, I would see that a lot too. We don't want to ruin their recovery. We don't want to endanger them, but they're living with it. Yep. And I'm just kind of wondering what your experiences are with people who are afraid to address and treat people's trauma.
Well, I think sometimes it's a lack of training, that they're not necessarily wanting to admit to the fact that they don't have the skill set to properly treat trauma. So instead of owning that, they just say, oh, we're just going to avoid it or stay away from it. And I think that, I think that's also something, Patrick, that you and I have encountered locally when, you tried to invite the local therapy professionals to attend an EMDR training up here, and no one signed up. So there's just, there's a lack of training, there's lack of skills, just ignorance, fear. But I think the other piece too is, I think there's also a fear of how a client's going to react, in terms of an abreaction, so a really strong emotional response or physical response to whatever it is we're working on, or dissociation. People might be afraid of that. Clinicians might be afraid of their client dissociating and not know how to handle that in session. And again, that speaks to a lack of training. And that's just, if, like we said earlier, everyone coming into our offices has some form of trauma, so everyone needs to have some level of training and understanding in how to treat it effectively and appropriately.
And also, when we're talking about trauma, we're not even just talking about being trauma informed as clinicians. You both work in offices. You want all of your staff to be trauma informed. Anyone, like when you walk to the door to when you leave that door, the idea is that client should feel safe as best as we can. I mean, working by myself, I can kind of control myself. I mean, even though we get into fights with each other, me and Matrick, when Matrick jumps in the mix, we gotta like, shimmy shit up a bit. But definitely, it's like, when front staff or people answering the phone or making appointments aren't trauma informed, it wreaks havoc. It damages people.
Right.
Paula, what about you? What are your experiences with other people in the field who are afraid of trauma?
I judge them immediately.
I just started reading a book called The Judgment Detox. I'll send it to you.
Oh, no, I still want to be judgy. Thank you. I try to educate ad nauseum. However, it's very exhausting. And so therefore I just kind of disengage. But then when their clients wind up coming to me, or I have somebody who's coming in who basically doesn't want to go anywhere near their trauma because, somebody messed it up for me, either through bad EMDR or through trying to do cognitive processing therapy or TFCBT. Oh, I don't want to look at that again. Or I already processed that because I did TFCBT. But anyway, I'm getting off on a tangent. I think with the EMDR being the cult that we've formerly been known as, hopefully not so much anymore, I feel like sometimes people will shut off my opinion because they just don't want to hear it because they think what they're doing is just fine.
I can't imagine someone trying to shut you down. Like, that won't end pretty.
So the owner of my practice is on here, Sarah Coates.
Hi, Sarah.
Shout out. And she put me in a position of clinical director a few years ago. So yeah, and all of our clinicians are contracted. So I can't push my values on them, just like we can't push our values on clients. But nonetheless, about half of our practice is EMDR trained now.
Oh, wow. That's amazing. Yay. So Elizabeth did respond. She said, I asked because trauma-informed pedagogy entered higher education big time this year. She wants to learn more. On top of the usual trauma, we now have COVID death and racial injustice students' experiences.
Yes.
And that's for me, and I'm glad she said that. It's with, when we're talking about being trauma-informed, we have to look at all of those components. It's like a giant honeycomb. There are constantly different facets of where trauma can affect people's lives. And if we don't continue our education, continue challenging ourselves, asking ourselves, you know, what privileges we have, what traumas do we have, what have we done that works, that doesn't work, we're not doing justice to ourselves or to our people, in my opinion.
Yeah.
I think,
I mean,
you're jumping on what Elizabeth is saying, you know, trauma-informed goes beyond just the therapy office. It absolutely goes to college campuses, schools, whatever it might be. And I think in those instances and in our offices and our practices, it's, are the people coming into this building feeling emotionally safe and physically safe when they enter? You know, are they walking around campus feeling emotionally safe and physically safe? Are they coming into our offices feeling those ways? And if not, then we need to take stock of what's happening that's keeping them from feeling emotionally and physically safe in our practices. And if, you know, environment plays a big role. Do we have our practices and our offices set up in a way where someone feels comfortable and safe enough to open up and to do the work that they need to do? Or does it feel sterile and clinical and uncomfortable? And, you know, it's, environment plays a huge factor in this.
Blaze is sharing the thing about it, though. Racial injustice has always been a thing. It's always been an issue, just many are late to the party. And I would agree to that totally.
Yeah. Yes, and that's a special area of interest of mine because my children are biracial, and my future daughter-in-law is Latina. So it's very important for me to educate clinicians in, you know, working with persons of color, and LGBT folks, of course, whatever, because I might look like this, but I'm woke AF. So,
right.
And if nobody knows what that means, Google it.
Right. And one of the things too that I find is when someone once posted something is you can always do better. And I think that just gave me hope for myself of mistakes that I've made in the past, things that I didn't even know were wrong or inappropriate or prejudiced or, you know, whatever it may be, not aligning who I want to be. And just knowing then I make up for it. Just like we tell our clients, we can always do better. And learning from ourselves, and that's one of the other piece too, I think, of being a good trauma-informed therapist, is we rely on each other. Like part of that is when we're focusing on how to provide good care for our clients, we have to do it for ourselves.
Yeah.
And that's many times and I've actually reached out to both of you when I'm struggling, and usually your first response is, what are you doing to take care of yourself? And I usually don't have the best response, or I might just not respond.
Let's see. Dole Whip. That's your response.
Do you know Dole Whip is magical? I allow myself one. It has a lot of sugar, which doesn't always, is not, but they change it every week. It's like magical. It's a summer treat. I feel like I'm getting judged.
You're not being judged, darling. I drink Coca-Cola, the Mexican Coca-Cola, every day. It's a total addiction of mine. I buy it by the case. It's okay. Let's out ourselves. It makes us better. Vulnerability. I learned from the best.
I don't know. You jump in. What do you both do for self-care?
I'm a food addict.
Okay.
Yeah. No, legitimately. Yeah.
Okay.
My two dogs are my go-to self-care items, if you will. I find joy and comfort in them, and being around them and spending time with them and doing things with them is absolutely my therapy at the end of the day.
Okay, so the more PC answer is I lost a dog on May 21st, but I got one left. So she's, even though she likes Richard Ford better than me, it's true.
She's not bitter, hashtag bitter.
Hashtag bitter, slightly. Anyway, I'll get another dog that like me more than they like him, so it's fine. But anyway, so I'll go with the PC answer. The dog going for walks, but it's too freaking hot in North Carolina right now. It is hotter than getting the salsa roja at Chipotle and going to the bathroom after. Not that I'm saying that's actually happened to me or not.
No. Full disclosure, hashtag, I don't even know what to hashtag with that.
Hashtag blowout.
I think like I can go for carbs when I'm really stressed.
Yes.
I read somewhere once eating carbs is like an internal hug. I'm like, sweet Jesus, it is. But like one of those things too of, you know, working out, it does actually help you feel better, which I don't want to admit, but I'm going to, you know, trying to watch where you eat. One of the things too that I realized, especially with the pandemic, not drinking enough water, which then messes everything up, and taking time out for myself of just saying, hey, I need a break to process this, and reaching out to a friend or to a colleague and saying, hey, I'm had a rough week. And what's nice about reaching out to a colleague, you don't have to explain anything, they know.
Nope.
It's like, all right, so what, and usually when I do, it's the response I get is, what do you need? Or what do you want to talk about? Or what can I do? And usually it's kind of like Friday Night Feels. I mean, that's kind of how I try to be, of that consistency of it's that seriousness, but it's also that humor, which for me brings hope.
Mm-hmm. And I've tried to do EMDR on you, darling.
I've been busy.
Making excuses, apparently.
See, that's judgment 2. That's strike 2. If we get to 3, you might not get an invite back to the Friday Night Feels.
What if I'm popular? There's a whole lot of people from North Carolina on here right now. Just saying.
You know, one of my brothers lived in North Carolina, and he said he loved it. I've never been.
Well, I've been trying to tell you to come down.
There's a pandemic.
I don't have COVID.
Oh, but in the flight, they might, and I don't want to die. So.
You can drive.
Oh my God. Can we just continue this after? You're killing me here.
Sorry, honey.
It's getting dramatic. So when, and I think the other thing too, you know, going back to about trauma is, I think sometimes people are afraid of it because they don't know what to do with it, kind of like what you're saying, Amy. But I mean, when we talk about countertransference, is when a client triggers us, sometimes they're a mirror of, wow, there's stuff in me that I've never dealt with. And I think sometimes one of the most damaging things that I experienced entering the field, and I hope anyone that's listening that's in the fields, students, whatever, was the message that if you're in the field, you shouldn't need therapy, that you shouldn't need help, that you are the expert. And it damaged my well-being for a long time. And then when I got out of that working environment and I saw how toxic it was, then I was able to, I went into a working environment where everybody was in therapy. And it felt, my spirit was, okay, I've been wanting this, but I thought, because all these people were in the field longer than me, who were more licensed and more credentialed than me, knew better, but they didn't. And one of the things that when I'm teaching classes or when I'm working with people in groups and stuff is the importance of, we all need therapy at some time. We all need someone to talk about. And there's so many different ways to do it. But reach out. One of the other pieces too, and I know we have a few minutes left, that just popped into my head is I've had people who I've worked with who part of the healing has actually been because they received poor EMDR. And I had a friend of mine point that out of, she's heard about EMDR, she's wanted to try it, she hasn't been able to find anyone, and because we're friends, I can't do it on her. And it just broke my heart when I heard that of people, you know, who've gotten poor EMDR or harmful EMDR from people who weren't really trained or didn't follow the protocol. And I don't know what your experiences are with that for the two of you. You're both nodding heads, so.
I've heard similar things, you know, people wanting to try it again. They have faith that it works and that it's a very helpful approach, but that they did have a negative experience in the past, or, you know, it wasn't completed in the past for some reason. But yeah, I have heard that as well.
Same here. And it's difficult when you have someone who your gut's telling you, oh my gosh, I so need to do EMDR on you. And they're afraid to do it. I'm not talking about you, Patrick.
Well, you're pretty subtle, so I was like picking up on the vibes.
Oh, my goodness. No, but like, seriously, I have a client, I've had her for years, who had bad EMDR. So when I got trained, she was very hesitant to want to go there. But I did it very textbooky and explained all of the things and did everything properly. And now she's been with me for like 3 years.
Wow.
Doing EMDR. So yeah. And a lot of times I've had to go back and fix other people's bad EMDR, you know, or people who come in and say, my last therapist wouldn't do EMDR on me because she said I dissociate. Okay, no problem. And they're like, oh, you can do that? Yes, I can, actually. I really enjoy doing EMDR with dissociation. So, and I explain how this approach is different, how we're going to do a lot of resourcing and things like that before we start. And I always try to, you know, Dr. Shapiro wants us to go to the oldest memory. I will usually do a present prong target first so people can see that they can be successful.
I do the same thing.
Yeah, I'm not going for the jugular the first time out.
Especially if they're new to EMDR, especially if they're new to me, I won't go that deep.
Right.
I don't
New to EMDR, had bad EMDR, had a bad talk therapist previously. Doesn't matter. And the more complex the case is, the more apt I am to stay in phase 2 longer and do the resourcing. And I'm going to do perhaps multiple present prong targets before starting to go in reverse.
Right. And for people who may not know EMDR, what Paula's talking about is when you're trained appropriately in EMDR, there are 8 phases. And you spend a lot of time, because the training is extensive.